And Diane Wood from Element Care is about to join us now. Morning, Diane. How
Hi,
are
Diane.
you? Nice to see you.
Thanks for
Well,
being
very
here.
nice to be here. Thank you so much.
Yeah.
Did you cross the street to get here?
I walked all the way over.
Well, thank you for coming. Yeah.
Diane, you are the center manager for
Yes.
the Emerson Ave location?
Yes.
Correct? Yeah. So what does that title entail? What do your duties include?
So I basically just oversee the operations of the site. So I've been with Element Care for over 16 years. So essentially, it's just making sure that if something is broken, it gets fixed. If there's a staff issue, that we work together with the other departments. So we have great staff. We have a very diverse staff. So it's just coordinating all of the things. I lead some team meetings in the mornings. We talk about what happened overnight, since we cover all of our participants through the overnight via an on-call system. So unlike other healthcare programs, we actually follow them 24/7.
So tell us, let's back up and
Yeah.
say, what does Element Care do? What are the services you provide and to whom?
Okay, so
Thanks.
all of our participants are 55 or older. They need to be eligible for nursing home placement, which sounds dire, but essentially it means they need assistance with 2 or more activities of daily living, which can be personal care, meal prep, shopping, bathing, money management, things like that. Medication management is a big one, or mismanagement. So you need to be eligible in that regard. And then there's a financial component. So 99.9% of our participants are Mass Health eligible. So we are a dually waivered program where people can use their Medicare benefits and their Mass Health benefits. And we use those, we pull them all together to provide services to all of our participants. So essentially, we cover everything that you would medically need. So even things that are like over-the-counter meds, nutrition supplements like Ensure or Boost, we provide all of those. We provide incontinence products. So all the things, they come and we provide them all the time, including we order meals, all these wonderful organizations that have come before me on your program today also benefit our participants. So we have a day program, which of course was very affected by the pandemic, since we also had to sort of shut down, and there was only essential people, myself and 2 nurses and some PCSs, personal care specialists, and then the other team worked remotely. But so
you have a medical staff.
It's completely, yes.
Yeah, so your patients, your clients are seeing your team of medical professionals, doctors and nurses, right?
Yes, so we have a full-time physician, full-time nurse practitioner. We have full-time nurses on site that you each would be assigned to your primary nurse. We have master's prepared social workers. We have physical therapy, occupational therapy, speech therapy, nutrition. We have a registered dietitian on staff, phlebotomist, medical secretary, activities. Who am I forgetting? So so many. We have interpreters. We have some people who, we actually have a large component of Albanian-speaking participants.
Oh, interesting.
Yes. So our physician, Dr. Omari, is Albanian-speaking. So we have a good portion of our people speak Albanian, but they come from Peabody, Salem, Beverly, and Gloucester.
So, and your clients are, as I understand it, it's people who are trying to remain in their homes and not
Yes.
have to go to long-term care, right?
So the goal is that we will maintain people, despite their eligibility for nursing homes, in the community. So we provide home care services, nursing services, PCS services. We contract with various home care agencies. That market has also been adversely affected by the pandemic because mothers had to, when they were remotely teaching, the mothers had to stay home with their kids, when school was remote. So it still hasn't really come back.
Yeah.
And people were also a little nervous about going into participant homes where people may be sick.
Of course,
Or,
yeah.
there was a lot of fear. So we do provide that. We do home visits. So if somebody is not feeling well and they meet the criteria for, say, for instance, COVID symptoms, we go out immediately and test for COVID. We have that capability,
Wow.
so they don't have to make an appointment, go to Yeah, we do all their labs on
So
site.
it's really comprehensive.
It's totally
Yeah,
comprehensive.
and dental, did you do that?
We do dental,
Right?
we do,
Yeah.
we provide hearing aids, dental, eye care, really everything you would need medically. We provide all their durable medical equipment. And, you know, it's a fabulous program. I really, I'm just like, oh, I can't wait.
Yeah, that's great.
Well, Diane, you talked about how the day program was impacted, right?
Yes.
So, as staff over there, how did it impact you to not be able to see those faces every day come in for the program?
So, we have here a lovely little grandpad. So we, you may see these advertised on TV, on the channels if you happen to watch shows that are from the 50s and 60s like I do. So this is an iPad designed for elders. And so it has the capability for Zoom. So due to the pandemic, we had to adapt quickly. And so providing social interaction and contact with our participants since they couldn't come in. And that was really hard for us because the one wish they had was that they wanted to come to the day program. So with the day program, you know, we would provide like a little breakfast and a lunch and activities, socialization, people form friendships, and also their medical care. But so the GrandPad has been fantastically popular. So I would say that 90% of the people in the community have a GrandPad.
Really?
And
So you distributed these right away when
we
COVID happened?
quickly contracted with this company and we customized it for our type of participants.
So is Zoom really easy to use on this thing? Because my mother-in-law
It
might
is.
need one.
I might get one. I might get one for myself.
Yeah.
So, yes, so we actually also hired 2 full-time remote activities people to simply do Zoom programming, which includes all kinds of things, exercise, bingo, and
I can play bingo on Zoom over this?
yes.
Oh, that's so
And
funny.
so it's participants from all different sites, so it's not exclusive to the Emerson Ave population.
Right.
So it's a lot of fun, and you can use this as a telephone to call your family. You can store photos. It's really a wonderful device.
Yeah, I
but
can
we,
see that.
We do
Large
use
print.
it. And we can do sort of like a video, like if you're sick and you're at home, we use it as like a video telehealth.
Of course,
You
yeah.
can see them and see what
So
they
you can
look
check
like.
in with people.
Correct.
Yeah.
So this
Right.
has been a fantastic innovation that we sort of probably would not necessarily have utilized. We
Right.
had avatars in place for our participants, which is a different type of support system, technology support. It would allow them to, play music and talk to somebody, but the person was like a remote.
Yeah.
So it was very, very different, and so it was very
Super
limited.
simple, super clear.
This is super.
Yeah.
I can do it. I had a little
Yeah.
lesson before I came. But, so this GrandPad really keeps people in touch. They can call us on it, we can call them on it. And as I say, we can see them, we play games with them, they play music, it's
So-
really been a fantastic thing.
I keep hearing you say gram pad.
It's
as in-
grand.
Grand. Okay. So I'm
I
like
know.
grandma's
Sorry,
pad.
it's the math. It kind of is a grandma
Right,
pad.
right.
No. It's called Grand
Okay,
Pad.
okay, that's
Sorry.
good to know.
I know.
It's the
sorry.
mask, but
My
I think
enunciation.
gram pad is pretty good.
Right, it is. I know. I'm thinking of my own mother, but yeah,
Yeah.
getting one. So yes, this is something that we really utilize a lot.
Well, Diane, for folks in the community who don't really know much about Element Care, what do you want to tell them? What do you want them to know?
I'm going to say that this is the best healthcare program that is around. I know that there are certain eligibility requirements, but honestly, I've worked in healthcare for 43 years. And I've worked in many aspects, and this is the absolute best healthcare program I have ever been a part of. It's totally comprehensive. You have such an incredible support system. You have so many people there to help you out, no matter what your needs might be. We deal with, citizenship issues and housing issues, and not just healthcare, not just socialization. So I think it's something that people should take advantage of. It really is such an incredible benefit, and I know people I don't want to leave my primary care physician, but honestly, we've never had anybody regret it. So for
Yeah.
instance, we always say, if you are nervous, you can check in with your primary care physician that you had before you joined and just make sure that they agree or that you're comfortable with, they're comfortable with that. And really, they stay because the services are wonderful, the team is fabulous, and the support is really wonderful too. So, yeah.
Very
And
nice.
helping to keep people in their homes, that's so important.
This is our major, major goal. We really try to respect the participants' requests and staying home.
Yeah.
at
And,
all
and
costs.
if people want to learn more about Element Care, how can they go about doing that?
So they can contact, I'm cheating. I have this number here.
Yep.
They can either call 1-877-803-5564 and speak with our information and referral specialist, or they can email info@elementcare.org.
Right. And there's also the website, Element Care.
There's also the Element Care website that you can seek information, or you can just toddle on over to 29A Emerson Ave, walk in and ask me for a tour, and I'll be happy to do it.
There you go. Go
That's
see
great.
Diane,
That's
folks.
great.
Diane Wood, thank you so much
Thank
for spending
you.
time with us. It was great learning a little bit more about Element Care.
Yeah.
Pleasure.
Have a
you
great
so much.
Thanksgiving.
Thanks, you as well.